procedure done with you, and he had said he had a rough day of it. So for a lot of the people, and this is a question I've never asked, as much as we've talked about stem cells, what is the recovery time for a dog that comes in and has, if I was going to bring Sinatra in to get stem cells taken out and frozen, or
Right.
what's the recovery time for something like that? Or is it
So-
different with every?
In the case of your friend's dog, though, was injecting the elbows and there was a bad hip, and injected the hip and then gave some intravenously. Well, some dogs. So for arthritis or dysplasia, which is abnormal development of the joint, the hip joint, instead of being a ball and socket, 50% or more out. So it hangs around and gets advanced aging, advanced arthritis. And that can be painful. And that's a biological. When I give stem cells, I'm not fixing that joint. That's a mechanical issue. I'm just treating the biologic issue and hopefully regenerating cartilage, reducing inflammation, modulating the immune system. And that's the prayer and the hope of stem cells. And most of the time it works. And when I say most of the time, I don't usually, I can't guarantee a treatment, but it's generally, if we have a reasonable expectation when we're treating something, it's generally in the 90%. So, for arthritis, now if I'm treating kidney disease or heart disease, that's a whole different ballgame. And that's compassionate use. I think I'm going to be treating a collapsing trachea soon. That's a compassionate use, meaning we don't have any evidence that hasn't been studied by our group, and we don't have any evidence that it work, but there is rationale that it might. And the owner is willing to try it before they give up the dog, and I get that. That's a decision that make with an ethical discussion about reasonable opportunities for repair versus unreasonable risk versus reasonable protection. And we want to try it. That's certainly a good case. We did that on a COPD dog, talking about chronic pulmonary disease. Dog was snoring, wheezing, having trouble breathing. It happened to have 2 vials left. This dog had cells banked, years prior. And they didn't want the dog to die without using those vials. And they called me up and said, Dr. Mike, what do you think about using it for this and see if it helps? I said, yeah, I think it's a great idea. I do hope it's a great idea. There was rationale for that on the human side. People on pulmonary disease, when all the airways get scar tissue and it gets harder to transfuse oxygen, it's harder to breathe. And traditionally, when you went on those oxygen, progressive disease, you get to that point where you have to oxygen and get it all the time. And then they had people riding horses in the Rockies again without the oxygen after treatments over in Greece and in different parts of the world. So I called one of my mentors and he said, yeah, there's good rationale for that. So we called the cells back. We gave the rest of the cells, and the owner informed me that within 24 to 48 hours, that dog was still for like 4 months. It was just breathing so much easier. They were so happy that we used it. And I just sat there in awe. One more thing that the stem cells did. And thank God the owner talked. They said, hey, I have more vials left. What do you think? And it was like, yeah, I get it. This is, your dog's having a lot of trouble. I get it. Nobody wants it. So, what's reasonable when I treat? So it all depends on the severity of the disease, injecting those joints and every process. Typically, in 1 to 3 days, they're getting a profound anti-inflammatory effect from what those stem cells are secreting. And when we can give anti-inflammatories like ibuprofen or meloxicam or privacox, no steroids, because steroids inhibit the proliferation of the stem cells. Galaprant, which is a type of non-steroidal anti-inflammatory drug, just by the way it works, the pathway, it's an EP4 inhibitor, just by that can cause a decrease in proliferation. Proliferation is when they multiply. Stem cells, by international definition, so they have to have the ability to make new cells, replicating cells. They have to have the ability to differentiate fat and bone. You have to be able to prove that. And the cells I use, they've been proven shown cell banks. So that's by definition. I would add